For many without insurance or even those with limited coverage, low-cost clinics provide the health care they need. But federal budget cuts could do away with more than a quarter of the funding for those clinics. Our Candace Lee spent the day digging deeper into what that impact would be.
All right, Andrews, I haven't seen you in a few months.
Yes.
You were having wrist pain last time I saw you.
Yes, and then I have
Andrew Dielman is one of 5,500 patients who seek medical care at Lower Lights Christian Health Center. He came here for the first time 20 months ago, unemployed and in pain.
The Lower Lights Health Center has been very good to me, taking care of me in my time when I had no health insurance.
Taking care of the underinsured and uninsured in Columbus make it more difficult in the months ahead. Federal spending cuts by the House of Representatives eliminates $1.3 billion for the nation's community health centers. That's a $700,000 budget cut for Lower Lights, about 25% of the clinic's annual budget.
We don't intend to close, but over the last 2 years with that funding, we've dramatically increased the number of uninsured patients that we've been able to provide much needed care for, as well as the scope and breadth of the services.
While private insurance as well as Medicaid and Medicare are accepted here, most payments are on a sliding scale based on income, and most patients pay only $10 for care.
For every dollar they save short term, it's going to cost $3 long term.
While Andrew is now employed with health care benefits, he still seeks treatment here, citing his comfort with doctors and nurses.
I work a tremendous amount with the homeless here in the area with different ministries, and this place here gives them a place to come when their diabetes acts up. I don't think our government is really in touch with the working class people and how tight our budgets are.
Representative Steve Stivers voted for the cuts. In a statement to NBC4, he says, "I've always been a supporter of community health centers, and this cut would simply take funding for centers back to the levels they received before the stimulus and health care bills. We just cannot afford the dramatic government spending increases from the past few years at the expense of our children's future." There is still hope for Lower Lights funding. The Senate is set to take up the House's proposed budget cuts, so there is still a chance it could be restored. In the newsroom, Candace Lee, NBC4.
And here are the fast facts on other low-cost health care options out there. Many retail pharmacies like CVS, Kroger, and Walmart offer quick care clinics in their stores. Some urgent care centers offer discounts for cash-only customers, and your local health department offers some preventative care options like flu shots.